For the last 3 years, I've been in pain.
She had suffered through years of infection in her mouth. So this is her front tooth, completely out of bone.
That's when Belinda said, this is what I'm talking about. This is why this is the best way to do this, because not only do they take care of your bone, but they also do the gum as well, which is it's amazing. I'm very, very happy that I came to 3 on 6. My name is Alma Camperdon, and I started my journey with my teeth about 6 years ago. I went to the dentist regularly, and they told me that I was having loose teeth and that I needed to take care of that. Of course, I didn't listen. I just figured, it would be fine. Somehow it would get better or something. And then I went to a specialist who told me that my face was going to implode if I didn't get this taken care of. And then she said that the only way that I could do it is if I had dentures. And I said, dentures? She said, yes. I'm like, I have to take them out every night? She said, yes. You have so much bone loss that we can't put implants. The only thing you're going to be able to have are dentures. Right after that, I think I got into like a depression of my mouth and just everything that, it's kind of, you feel like it's your fault that you've let your mouth get like that. 2 years later, I started going to different specialists and got different quotes. They all basically the same. Didn't tell me my face was going to implode, thank God, but they did tell me that there was a lot of bone loss and it was going to be very difficult to do implants, but that it could be done. A friend of mine, Belinda Young, has had this procedure done, and she did a lot of work, a lot of research, and she told me this was the best. Not only because I wouldn't be having an implant, that I was going to have food get in between my gums and the implant, but she just loved what happened with her. Well, I wasn't really convinced. I said, let me look around, because yes, your teeth look great, but it just sounds too good to be true. So I went to another dentist, my last specialist, and he said that they could do my teeth on the top with dental implants. And then he showed me this little brush that I was going to be having food get in between my gums and fake gums, and I could, take it out. And I remember thinking to myself, I'm going to have food all the time. It's going to bother me. And not to mention, she explained to me about the having the whole arch, and when you bite, you're putting pressure on the whole thing. It could crack. That's when Belinda said, this is what I'm talking about. This is why this is the best way to do this, because not only do they take care of your bone, but they also do the gum as well, which is it's amazing. For the last 3 years, I've been in pain. My front teeth was going to fall out any minute. There's a picture of me, which is terrible, but it's like my whole, my lips, all my teeth kind of being exposed, and then you really get to see how bad. Because not only was it bone loss, everybody has that little skin that ties from your lip onto your gum. That's gone. I don't have that.
So Alma traveled in from California to be one of our patients. She had suffered through years of infection in her mouth. She had one tooth in the front that I'm surprised didn't fall out at nighttime while she was sleeping. Lots of infection in her bone that we had to clean out. It was a challenging case for sure, but our providers did an awesome job. So this is her front tooth, completely out of bone, just from all the bone loss just being held in by gum tissue. And then we scroll over to her left side, right here. She had a significant amount of infection up in here, all the way back. Yep. This one up here, you know, like this. It's the tooth that was falling out. There's the other big side of infection. She also had some infection right here. Nothing left in bone there. You can see the bone quite a bit better here, holding those in. These ones, you see the roots all the way down. Just nothing holding it in. Big infection right there. And another large one right there.
Surgery morning for me was actually, I was very nervous, but more than anything, I had confidence in the staff. I think because of Belinda and what she went through and how great her teeth were, and she's my caretaker here, I was nervous but confident that they were going to do a good job, that I was in good hands.
The surgery went super well. We got all 6 implants in. In fact, I think we gave her an extra one. So we ended up with 7 implants on her upper and 6 on her lower. She turned out, it was super solid, bone grafted everywhere where we needed to. We're really gonna try to gain back some of that bone that we lost because of the infection. And a lot of that's gonna depend on her and how well she's taking care of it over the next 3 months. And we hope that we get all, or if not as much as possible, back from what she lost. And then in 3 months, we'll get her into her Zirconia finals and have her looking awesome.
My surgery was on Saturday, so I'm 2 days in, or 2 days out of my surgery. It went very well. I mean, I am swollen. These are my temporaries, so it's a little difficult to, you know, I'm getting used to them. Plus, I'm also got stitches in my mouth. I'm so grateful that everything just doesn't hurt. I mean, it hurts a little bit. I have a little bit of pain, but nothing like I've had for 4 years. Typical healing time is about 3 months, and for me, because I had such extensive bone loss and a huge infection both here in my front teeth and the side, that it's going to take 4 to 5 months for my healing, and just lots of care for me. They're going to continue to improve on my smile. You know, these are just temporaries for the gums to heal and the bone graft. And then once my permanent teeth, then I'll have a perfect smile, and I can't wait. I'm very excited about it. I can't believe it's taken me so long to get here, but I'm here now, and it's the start of a whole new world for me. I'll be able to eat. My God, I can't wait to be able to have a pizza without cutting it up, a hamburger without cutting it up. It's going to be a while before I can do that. It's going to be like 5-6 months, but that's okay. I can wait. I'm very thankful for the entire staff of how nice, understanding, no judgment, not making me feel ashamed of my teeth, just pure understanding and care is what I've had here. So if anyone out there that has problems with their teeth, and especially a lot of bone loss like I did, definitely consider the Smile Clinic.
All right, a final look here. Holes all filled in on the bottom, looking perfect.
Yeah, look good. I'm feeling a lot better. I really am. I mean, I can't believe how far I've come. I mean, I knew it was going to be a pretty long process,
Yeah.
but I mean, here we are. It's been, what, 5 months?
Yeah, and yeah, you're looking great. Looking great. Infection all out of there. Gums are looking really good.
I like this color.
Yeah.
It's not too bright. It's not too crazy.
For those wondering, Alma here went with B1, which I like to describe as kind of the border of between where natural teeth can get to a level of B1. So I usually tell people B1 is lighter than my teeth. So if I were to get like veneers, I could go with a B1 and it would lighten my teeth up. And then after that, we get into bleach shades, which then tend to appear a little bit less natural. But this B1 looks really pretty on you.
Thank you. I wanted it to look more natural. I didn't want it, you know, I didn't want it to look like fake.
A headlight.
Yeah.
Yeah, you look really good. It just looks like a really pretty, happy smile. Good.
Thank you. Thank you so much, doctor. I'm sure you hear this a lot, but you've changed my life.
Good.
Yeah, you really have.
It means a lot. Makes it fun.
Yeah, because I was not a happy girl.
Yeah.
At all. I was not happy, and
Yeah.
I'm happy. I'm very, very happy with the way they turned out, the process. You know, giving up some food for a little while was not that bad,
Okay,
especially
good.
when I was already used to not eating certain foods.
Yeah, with that infection in the front, when was the last time you bit into an apple? It's probably been a while.
Probably about 6 years.
Yeah. So, yeah,
Maybe
put
7.
them to work.
I will.
Put them to work. This
I
should be
will. I
fun.
can't wait. I can't believe that I went that long without
Yeah,
being able to be normal, you know, eat normal food, and
for sure.
didn't even want to go out to dinner. I didn't want to go anywhere. But that's all going to change.
That's all changing now.
Yes.
You look amazing.
Thank you. Thank you so much.
Yeah, you're welcome. You're
happy.
welcome. Okay, give me a hug.
All right. Thank you, Dr.
You're so welcome. They'll get you finished up and get you out of here, okay?
All right. Thank you very much. No, I'm very, very happy with this, and happy with the staff, and just my doctor was the best. If I was to rate the experience from 1 to 100, it would be 100. I got a new smile, and I can't wait to go eat. If you do your research, you're going to find that this is the best place, because the fact that they don't shave bone, that they do bone grafts, they do gum grafts, and I think out of all the teeth that I've seen, these are the best. They're my teeth, they're my gums, it's my bone. They didn't do any shaving. Yes, it was a very long process. It was 9 hours of surgery, but I never once got to see myself without any teeth. I'm very, very happy that I came to 3 on 6. And if you're thinking about getting your teeth done, do your research. And I have a feeling that you're going to end up here, because this is 3 on 6 is the way to go. For the 3 on 6 YouTube community, please like and subscribe. And thank you so much for liking our videos and being a part of this wonderful, wonderful community. 3 on 6.